Hi everyone. Since pancreas mass and tumor are very important, especially diagnosis at the early stage, is critical for patient survival and treatment, especially when cancerous. I strongly recommend all tech, ecotech, and vascular tech. Get familiar with the pancreas, at least in the level of the IVC and aorta. Now let's go on this case that we have pancreas mass. Here we have, as you know, for IVC and aorta subcostal, we go longitudinal view at the mid and we get these images. First of all, can you say what those structure are? Is this IVC or aorta? And what those all structure market? Can you guess? Here is location of the pancreas and relationship with other organs. As you can see, we have skin, muscle, liver. Below the liver, we have stomach. Then we have pancreas, and posterior to the pancreas, we have at two level. At the midline right, IVC, midline left, aorta, and posterior to that, between them, portal vein. That top at the posterior to that is portal confluence, that is joining of the splenic vein and superior mesenteric vein together at this level. It create portal confluence, or you can name it beginning of the portal vein. Posterior to those, we don't have any structure except we have perirenal space that is includes some fat, connective tissue, paravertebral muscle, and rib and vertebra, depending which level we are. Uh, at, at, we don't have any other structure posterior to the pancreas at those level. Now let's see how it looks like pancreas when we get IVC and aorta in the subcostal longitudinal view. Now it become very obvious that mid-gray echogenicity is liver. Here we have, this is IVC because it's irregular size and thin wall, and with the respiration and heart cycle, its size change and wave shape. You can see it on aorta. Shortly I show is a straight cylindric shape and thick wall, and pulsation and color Doppler help you a lot. And if you angle up, fanning up, you see the IVC joined to the right atrium. Then we have here that anterior to the IVC, we have pancreas. The echogenicity of pancreas, depending on the age and other parameter, including weight, is overweight or alcoholic or not, is different. But generally, for the kids and neonate and small kids, infant, is more hypoecho. With increasing age, become little by little more echogenicity. In some at the middle age, it become almost close to the echogenicity of the liver. And when they go older, or those fatty infiltration or alcoholic or other situation, and old age, it become hyperecho. As you can see, this is hyperecho compared to this one. This patient is 65 years old. So that is our pancreas at the that as I explained, the vessel that pass through to the head of the pancreas is portal confluence, or beginning of the portal, being joining of the splenic vein and superior mesenteric vein and inferior mesenteric vein too. All those three together depend the normal variant. The combination of those become finally portal confluence, and above the head of the pancreas we called it portal vein. Posterior to the IVC, as I mentioned, we don't have any structure except the retroperitoneal and perirenal space. So in this case, if you focus on attention, this part is a mirror image of that. If you fold it at this level, and you can see exactly match up with the top one. So this is mirror image of this part of the pancreas. There is not only one structure, important structure, passed through the posterior of the IVC, beside of the uh, kiloduct, lymphatic duct, all those structures, small structures that we don't see usually. The only important structure is right renal artery passed through posterior to the IVC, as you can see on this one here. This one, is right renal artery that passed through posterior to the IVC. We don't have any other structure posterior to them except those connective tissue and retroperitoneal. Here we have at the aorta, as you can see, cylindric shape, pulsation, and color Doppler, and the branches, the most important branches, the first branches is celiac and then SMA. This is a feature, characteristic feature of the aorta longitudinal, and we can appreciate the pancreas at this level. You can see this hyper echo border is our pancreas. The celiac and SMA pass through to the head of or neck of the more accurate neck of the pancreas and go supply to the those terminal branches to splenic, hepatic, and this one to go to SMA to the intestine. And here is a different level, a little fanning more to the right of patient. You can see SMA here, uh, sorry, superior mesenteric vein, SMV. This is vein goes through. So this is our pancreas, all of it. The hyperecho area is pancreas, and we have aorta and liver. So it's very clear, and I hope this is help you when you scanning aorta and IVC. Just for a few seconds, attention to the pancreas. If you see something abnormal, mention it, go a little more detail, and at least you maybe you can save some patient life. Here is our case. As you can see, we were looking for the IVC. Suddenly, we noticed there is a completely border with the clear border mass at the level of at the pancreas, head of the pancreas, and you can see IVC posterior to that. You can see the border of the mass very clear. Limitation and even vascular go around that mass. Here, if pause it and measure it, you can see there is a mass. It was size over 4.5 per 4.9 centimeter in these cases, and patient went to the CT scan. So generally, when you have such things, remember that those anatomy and shape is changed because of mass effect. Just follow those landmark, find those landmark, then based on the landmark, you can make decision exactly what that structure you are watching. I hope it was useful. Up to the next time. Have a wonderful time.